Casey, can we talk a little bit about your sexual history? Are you currently in a relationship?
I am currently in a monogamous relationship, so
Okay.
I do have a boyfriend.
All right, so I'm just going to ask you some questions. Have you had any weight gain over these past 3 months?
No. Nothing, no,
Okay.
nothing.
Any blurred vision or difficulty with your vision? No?
No.
Any ringing in your ears? Okay. Any
Screaming children, maybe,
Yeah, I understand. Any recent colds or sinus infections?
No.
No. Any like sore throat or poorly healing lesions inside your mouth?
No.
Swollen glands? No.
Nothing really, no.
Any like lump on your neck in this area?
No.
Okay. Any extreme sweating or feeling really cold?
Nothing more than usual,
Okay.
A little sweaty, but.
Any wheezing or trouble breathing?
No.
No. Any chest palpitations or chest discomfort, chest pain?
No.
Tightness in the chest? No. Any, well, we already talked about how you've been having the increased urination.
Yeah.
Any GI upset, like nausea, vomiting, any,
I haven't gotten sick, really, no. No, just
your bowel movements are still regular and normal? Okay. Any increased hunger lately?
No.
Okay.
Nothing.
All right.
Normal.
All right.
Let's say.
All right. So let us continue and proceed with the physical exam.
Okay.
So you can just stay right there.
Okay.
We conducted a Snellen chart exam of Casey's vision, and her vision was 20/20, and she states she gets yearly ophthalmologic exams and presence of no blurred vision. I'm going to use the otoscope to inspect her for any AV nicking or cotton wool patches.
I scratched my eye because I was itching it, so it might be a little red.
Oh, no problem.
Okay.
No worries. Just look straight ahead at me and keep your eye open. Okay. Good. I'm just going to also check your pupils for their reactivity. You can just look straight at me. Good. I am just going to ask you to open your mouth. Inspecting Casey's pharynx and mouth. Can you lift your tongue for any lesions or thrush inside her mouth? Her gums, no signs of bleeding.
Got a cavity filled the other day. No big deal.
I'm just going to palpate Casey's lymph nodes. Any tenderness here, Casey? No. I'm going to inspect her thyroid for any enlargement, and I'm going to ask her to swallow. There's no thyroid enlargement. I'm going to just auscultate Casey's lungs. So just take a nice deep breath for me. Good. Now go on this side. I'm going to listen to our heart now. You can just breathe regular. I'm going to auscultate Casey's carotid arteries for any bruise. So I'm just going to ask you to turn that way and hold your breath. And this way. Good. I'm going to auscultate Casey's abdomen in all 4 quadrants. I palpated Casey's abdomen and noted no spleen or liver enlargement. I elicited for CVA tenderness, and that was negative as well. I'm just going to ask you to come over here and lay down, Casey. So I'm just going to examine Casey's skin. I'm just going to take a look at her arms and see if she has any lesions or poorly healing wounds, inspecting the color of her skin for any abnormality. Can you just turn your neck, Casey? I do see some dark spots, dark lines in between the creases of Casey's neck folds. Have you ever noticed this, Casey?
No.
Okay. So we will make note of that. I'm going to take a look at Casey's feet.
Going for a pedicure tomorrow, all right?
Looking for any signs of edema or I don't see any changes in color. I'm going to inspect her pulses in the posterior tibial pulse. And the anterior as well. Her pulses are both +2 bilaterally. I'm going to look in between Casey's toes for any skin changes. I'm going to look at the bottom of Casey's feet for any lesions or poorly healing wounds. I am going to elicit for sensation in Casey's feet with my reflex hammer. So, Casey, I'm just going to tap here, okay? Good. Good. And then I'm going to test the vibration with the tuning fork. So, Casey, this fork is going to vibrate, and you're just going to tell me when you're not feeling it anymore. It's usually after a couple of seconds, okay? So I'm going to look at the bony prominence. Okay, you don't feel it anymore?
No.
Good. No? Okay. Okay. I'm just going to test down here for more sensation. Casey, do you feel this? Do you feel this as well? Mm-hmm. Good. What kind of shoes did you wear today, Casey?
Just some.
Do you mind if I take a look at them?
Sure. Yeah. Just little
These are Casey's shoes. Perfect.
Comfy shoes.
All right. So we also collected a urine sample on Casey. So I just, before you came in to the exam room, we did collect a urine sample on her. As for the patient today, Casey's physical exam was unremarkable. There was no AV nicking or cotton wool patches in her otoscope exam. There was no thyroid enlargement or presence of a goiter. Casey's pulses are +2 bilaterally. She has sensation and reflexes positive in her lower extremities. As far as problem-specific findings, we did note some dark lines in the creases of Casey's posterior neck, which would be a problem-specific finding. We are going to ask Casey to go get some labs drawn, which we will discuss as a class. We will also go over some differential diagnoses together and the pathophysiology that is likely going on with Casey's diagnosis and the treatment plan, as well as the role of the nurse practitioner throughout this process. So thank you so much for your attention.